Some breaking news out of the United Kingdom. Prime Minister Boris Johnson announcing a nationwide lockdown. Let's put this up there on the screen. After a new COVID variant, which has actually caused their caseload to spike pretty significantly. There's not a lot that we know about this variant. It's actually quite difficult to detect because you don't know if you have it unless you're hospitalized, which is a very small percentage of COVID patients. But from what we do know, it seems to be somewhere in the vicinity of 50% more transmissible. And transmissibility without an increase in lethality is actually kind of a nightmare scenario because it leads to more infections and then more infections from there, obviously leading to exponential growth. And I think the reason that this story matters a lot, given the fact that we're in a disastrous vaccine rollout, is I would not be surprised, given now that we have confirmed variants in New York and in Florida and in other parts of the country, for this to be spreading like wildfire throughout our own, which could have major public policy implications. I saw a post from Tyler Cowen this morning in Bloomberg saying that if you thought the trade-offs discussion was bad whenever it comes to like lockdowns and all these other things in the old COVID with the new COVID variant, it could be 10 times worse. So this is one of those things where you'll hear us say it, might roll your eyes. 3 weeks from now, I do think this is going to be one of the biggest stories in the country.
This is our future right here. This is our future. And Boris Johnson was under pressure for a while to actually close things down, including schools and other facilities, because this strain was already out. There was a bit of a scandal there where it was revealed that he had been warned in December that this was happening. And so there's been pressure building on him is the point. And I saw a stat. They have hospitalizations in England have spiked 30%. There are 30% more people in hospitals in England this week than last week. In one week, they've seen that increase. I saw an analysis just to help me wrap my head around it, and you as well, from Zainab Tufekci saying, look, between having a more infectious, more easily transmissible disease and a more deadly disease, you would actually rather have the more deadly disease because that growth would be linear versus this, as you point out, is exponential. So what do the numbers look like? If you take a virus reproduction rate of about 1.1, infection fatality risk like sort of like the normal of what's expected, as things stand with those numbers in a typical European city, you'd expect 129 deaths in a month. If the fatality rate increased, so it became more deadly by 50%, that would lead to 193 deaths. So you start at 129. If it's more deadly, you get to 193. If you have a 50% increase in transmissibility, that would lead to 978 deaths. So it can be hard to wrap your mind around what exponential growth really looks like. We lived it here, certainly in the early days of COVID when we saw what happened in New York. We could be heading very much in that direction with a terrible political landscape where people feel like, you know, the lockdowns have been haphazardly administered, where there's been a lot of hypocrisy from public officials, where you've had even the, you know, gold standard of public health officials, Anthony Fauci, who lied about masks at the beginning and then also misled on herd immunity and what it would take and is trying to manipulate the facts and the data to match what he thinks public opinion can withstand. So you have like a completely broken environment in terms of the information system. Obviously, the system in terms of dealing with the disease, in terms of the economic stimulus, in terms of being able to get the vaccine out, it just makes for a very scary period. And it really, really, really sucks given that we should be, if we had competent government, we should be close to the end of this thing, and now this monkey wrench gets thrown at us.
Yeah, and this is what I feared, which is the disastrous public health rollout for the vaccine, which is what's happening in terms of public trust in the vaccine and the actual administering of the vaccine itself. And you combine that, a slow sprint, while you have a variant with exponential growth, we could be in this for a long time. And nobody knows what the hell works. I mean, look at California. Totally locked down. They have a disastrous number of cases. And then in terms of what the actual solution is, I don't think people have any trust in their public health officials or, I mean, not necessarily in the president or in Joe Biden. In our politically polarized times, we have no idea. We have no definitive, like, science as to what actually works on all of this. Maybe, you know, the only one really is, like, maybe wear masks because that protects other people if you're infected. And I just think, you know, it's going to be a big problem. I think this is going to roil American society in a way that has already been roiled, and I don't even know what the hell that looks like is the real problem.
I mean, look, we do know at the beginning of the spread, once they locked down New York, they're able to get under control. If you compare compare other European nations with what Sweden did, they had lower infection rates and lower death rates. So we do know that the lockdowns help to ameliorate this. But I do think that your point that the way that these have been administered, some of the things that, do defy science, where in New York you have schools shut down, but you had bars and restaurants still open, people look at that and they go, you all are full of it, and I'm just going to make my own choices here. That's when you end up with a really disastrous situation. The last point I want to make here, I was just looking at a stat on Twitter, this is from Heather Long over the Washington Post, that you have 1 million people who are still waiting on state unemployment benefits to come through.
Right.
Like, that's how broken, even the system, remember, because the reason we have relied on the unemployment system from the beginning is they're like, oh, well, we've already got it set up, so this should be easy to administer. Even that thing completely failed. And it's not an accident. When we see these failures, every time a state or a federal government tries to do anything, Republican, Democrat, Donald Trump, Joe Biden, all of these people, and it completely and utterly fails, this isn't an accident. This comes out of decades of anti-government rhetoric and anti-government politics that has stripped away our capability to be able to deal with a situation exactly like that. And that's precisely why we find ourselves in such a terrible position as we face this new threat.
Yeah, I know. I'm really scared to see where it all goes, but we wanted to make sure that we gave you guys an update.
All right, more Rising for you after this.